In our podcast, we talk about all the points related to taking a medical history, starting by defining patient history. So, what is a patient history? A patient history, or a history take, is an essential component of patient assessment, commonly known as a kind of academic writing that reports a patient diagnosis history in order to find appropriate treatment for his disease by asking him some specific question. Having a physician-patient communication is an essential component of medical history. The patient may not seek for a diagnosis when presenting his history, so the physician search for a diagnosis is sacramental is likely to be fruitless. Therefore, the patient problem must be resolved whether he has an attached medical diagnosis or not. Then we have talked about the domain used. Medical history is employed in medicine, one of the world's oldest professions that has never lost its sparkle, no matter how long it has existed, where the doctor writes an academic report about the patient's condition by asking him some question in order to obtain useful information about his situation and provide him with appropriate health care. And all medicine complaints reported by the patient are considered as one of the symptoms, and the majority of the doctor diagnoses are either in the private clinic or public hospital. This is a kind of a simple patient history taken. In each history taken, we have a main part, and the stages. So, what are the main parts and stages for taking a patient history? The stages are: introduce yourself by giving him all the information about your name, surname, and age. Presenting complaint. The complaint is the main factor that push the patient to result the hospital when he feel any pain or illnesses. History of presenting illnesses. It is one of the most important points in taking a medical history, where all the details of the complaint are written and the patient complaints are different according to his condition. Past medical and surgical history. In this step, the doctor will ask the patient about the type of medication he took previously and about previous surgery. A family history. At this point, the doctor will ask the patient about the genetic disease of the family. Social history. At this stage, the doctor will ask about the nature of the patient's work and standard of living. And here we talked about each part's role function, which are to allow the doctor to appropriate diagnose the patient. By simply obtaining a medical history, the doctor can determine the elements or disorders that are most common. It aids in the diagnosis of the element, which is the first step in the question for a cure. Determining the causes inherited of genetic disorder. To what extent do you grasp medical explanation and follow medical instruction? Being aware of the health concern that exist in the workplace. The patient willingness to undergo costly therapy. By writing down all the facts, he will ensure that he does not forget any detail about the present complaint history. In conclusion, the goal of history taking can be described as follows: to learn more about the same point you are expressing and to uncover concerns that aren't immediately coordinate the appropriate examination and investigation to arrive at a conclusive or differential diagnosis, to develop treatment plans that are tailored to the patient need. In our